following cataract surgery on this eye in January 2022. 2 weeks later, it went cloudy. And eye surgeons know all about that. They know what it is. I finally had the procedure yesterday, a laser procedure to take care of it. I'm going to tell you all about it in this video. Hi, I'm GloryB, and this is GloryB-TV, a lifestyle channel for mature women who want to look fabulous, feel amazing, and age gracefully. Women and men have cataract surgery, and it turns out it's not just for older people. In fact, the eye clinic I go to, they do this procedure on children. And so I was tired of not being able to see. I think when I first noticed the cloudiness from the cataracts, I was 57, almost 58 years old. So I decided to have it done. I just turned 62 when I had it done. So they do the two eyes on 2 separate days, 2 weeks apart. I've got a whole playlist talking about that. And of course, I will link it as a card in the upper right corner. So if you mouse over or tap over the upper right corner, something will drop down and you'll see the different videos and the playlist for all my cataract surgery videos in the order in which I did them. So this one I'm filming in May of 2022. And like I said in the beginning, 2 weeks and 1 day after the left eye was done, it went cloudy. And that was the day after the surgery on this eye. So I literally have not had really any time with 2 eyes completely clear. And the cloudiness has gotten worse. And I'm trying to remember when I made the appointment with the surgeon to say, he was very surprised to see me. And I'm like, yeah, this one's cloudy, because he sees this the day after surgery. So for a few hours, this one cooperated. And by the end of the day following the surgery on this eye, this one was just a bunch of clouds. So it's gotten filmier and filmier looking over time. It's been a real struggle, even to use my computer with my 2 big monitors. Using the phone, I had to close one eye. So finally in the procedure, if you get this cloudiness following cataract surgery, and it's been months since you had the cataract surgery, you can go in whenever you want to schedule this procedure, the laser procedure. But since mine happened so soon after surgery, I had to wait a few months because he said that cataract implant needs to really implant itself well into the eye. Okay. So I didn't create a video yesterday. I want to do a series. This isn't even the last clip because I want to tell you my progress, and everybody's a little different. But yesterday, when my eyes are dilated, they stay dilated almost all day, and I was miserable in the light. And with the studio lights here, it would just, it's uncomfortable. It's not painful, it's just uncomfortable. So I decided to talk about it today. Now, it's just an in-office procedure. It's so simple, and it's a very small machine. He sits on one side, I sit on the other side. The thing is, there was no one else in the room to hold my iPhone to take video so you could see what it looked like and hear what it looked like. So instead, I brought up someone else's, because I thought this was a really good example, except for the music. I wish the music wasn't there, but you can hear the sound of the clicking, beeping that the machine makes, and you can see the patient having the procedure done. So it's just like click after click after click. Now, he said I could blink. He said if I need a break and I need to sit back to let him know. I didn't. He needed to, because he was wearing a mask and it kept fogging up the little scope thing that he had to look through, which I know annoyed him. Yeah, I felt badly for him that he had to do that, but he had to step back and let the thing not be all, steamy. But he would do 4 clicks and then I would blink. And then he'd do 4 clicks and then I'd blink. So I thought if I can get in a cadence like that, then he knows when I'm going to blink. And he's just popping out all the little bits and pieces of the cloudiness as we go. And I would say from the time I sat down and he got my chin in the thing and he turned it on and started doing the work, it was maybe 2 minutes, maybe 3 it was really fast. And we didn't even go back into the exam room. I brought all my purse and everything with me, and then I left. Now, I did some reading on this, and they said sometimes you'll wait an hour before you, no, I just got my car and went home. And you can see, it's just like having your eye dilated for a regular appointment, but it's only one that's dilated. So you want to bring your sunglasses inside the clinic because you're going to need them when you go out. Or if they have, grab a pair of one of those that they'll let you go with you that has the side sunglass. That's awesome. So some people get clarity in as fast as 2 hours, and then they're completely clear. Some people, it takes 2 days. I could tell by about 6 o'clock in the evening. My appointment was around 1 p.m. So by the time I got out of there, it was 1:30-ish because I had to wait a little bit. 1:30. And by 6 o'clock, I was getting some clarity, and then an hour or two later, it'd be cloudy again. And then a half hour later, it'd be clear, and a half hour later, it'd be cloudy. So I'm still going through that today, even as I've been setting up for this video and looking in the camera and talking to you. It goes clear, and then it goes cloudy, and then it goes clear, and then it goes cloudy. So it's still adjusting. The other thing is, because they're breaking up little pieces of stuff, you get floaters. And there was another video I saw that showed what the floaters look like, and I was glad they showed that. It looks like little tiny black dots, almost like a tiny black insect. In fact, for a moment yesterday, I thought I saw a little insect on the wall, but as I looked up at the wall, the insect moved with me, and I thought, oh, I think that's a floater. Let me close my eye. So if you close the eye that you had done and you don't see the floaters, then you know that's not an insect. I also saw a little black spot on the kitchen wall today, but it was a little black spot. I closed that eye and yeah, it was a little black spot. So with the floaters, he said you can have floaters for up to 2 weeks. So that's not bad. I don't mind the floaters. I mind the cloudiness that comes and goes. And there's no follow-up appointment. He doesn't need to see me again unless I have a problem and I want to be seen. So 48 hours to me, so that would be tomorrow by 1 p.m. It should be totally clear and I shouldn't be here. But I think I'll wait. If I'm still getting some cloudiness coming, I might message the nurse just to ask, all right, is this normal, or should I be seen again for this? So yeah, easy peasy, really easy procedure. It'll just be really nice to have 2 eyes that see. And I wouldn't be surprised if I have to have this done again sometime in the future. It's just part of having a cataract surgery. And like he said, the younger people are, the more often this happens. 10-year-olds, 90% of them get this in both eyes at one point or another. 40-year-olds, half of them get it pretty quickly. But people my age usually don't get it that quickly. If it happens, it's usually a year or 2 or 3 or 5 or 10 down the road. You go in and have this procedure sometimes on both eyes. So yeah, I'm so glad that I had the cataract surgery, and I'm so glad I had this done, and I can't wait to see. So I'm going to come back and do a quick report later today. So procedure was on Monday. Today is Tuesday in May 2022. And we'll see if I have anything else to report. And I'll probably put this video together, when I don't know. We'll see. I just want to tell you it's clear like all the time. All right, that'll be the next clip. It's been that kind of day. My dog is newly paralyzed, so please excuse me. I had to leave the house and I had to crate her, and so she wouldn't hurt herself because it's partially paralyzed, and now she just wants to be with me like a baby. All right, so it's 5:30, and I would see how I'm blinking my eye. I'm having more more times of clear vision than filmy vision. But you know how you get that little bit of sleep in your eye and, you know, you're driving to work and you get that little bit of sleep and then you're just like, you can't stop and look in a mirror because you're driving, so you just start blinking. Like, that's going to make any difference. And it can when you have sleep in your eye, but now it just feels like I do, and I don't. So it's more often. So I think this is good. I think you've learned enough, and if I have a little bit more to say about it, about the following days, since this is just day 1 after the procedure, I'll put it in the description box below. So if you don't know how to open the description box, if you're watching on a phone or other mobile device, go below the video. On the right side, there's a little V. Tap the little V. That opens the description box. And there might even be a place where they have you click now that says more to get to really open it up. But I'll have all links down there, links to other videos, links to the playlist if you want to see more videos on my cataract surgery experience. And then if you're watching on a computer, go below the video on the left side, you'll see the word show more. Click those words show more, and that opens up the description box. I will say I'm having less floaters than I did yesterday and than I did this morning. I had a lot more this morning and last night. So yeah, but mostly little black. It's nothing to be afraid of, that laser procedure. It's wonderful. I told the surgeon I've been looking forward to that day for so long because I need to see out of both eyes. Anyway, if you have any questions, please write them in the comments below. And I try to answer every comment. You know, if you have a question about how to find the right eye surgeon for this in your area, how, you know, how did this feel? How did that feel? How did that experience go? Please write it and I will do my best to answer. And then check out one of my other videos by tapping its image on the right side of your screen, and I'll see you in the next video.